Hey everyone, it's Raj from 3CB Performance. Everton midfielder Andre Gomes suffered a devastating right ankle fracture dislocation injury on November 3rd during the team's 1-1 draw against Tottenham. There were very emotional scenes following the injury because a dislocation is such a jarring visual. It completely disrupts our mental picture of the intact human body. Accordingly, I've done my best to limit the amount of times you'll see the injury and have provided a warning before each instance. In this video, for which I consulted extensively with a trusted sports-minded orthopedic surgeon, I detail the injury itself, the surgery, Gomes' return to play RTP process, and the unique mental challenge he faces in rehab, and his return timeline and long-term outcomes. The injury is very likely what's known as a quote tibio-talar fracture dislocation. The tibio-talar joint connects the tibia shin bone to the talus, the uppermost ankle bone. A tibio-talar dislocation occurs nearly exclusively due to a sudden high-force trauma that gaps and separates the two bones, destabilizing the joint. Typically, this dislocation occurs along with a fracture to the higher part of the fibula, the outside bone on the lower leg, relative to the joint. The fracture is medically termed a quote Weber type C ankle fracture. Additionally, there's nearly guaranteed damage to the syndesmotic ligaments, aka the quote high ankle ligaments, and the deltoid ligament, which is a very strong collection of four ligaments that sit on the medial inner aspect of the ankle. This damage serves to completely destabilize the ankle, which was obvious based on the position of Gomes' ankle. Gomes went into surgery the following day, November 4th. The surgery involves reducing the joint and fracture. In other words, bringing the out of alignment anatomy back into alignment to allow it to heal. Most likely this was done via quote syndesmotic fixation with a relatively new technique called a quote tightrope procedure that's increasingly shown to have the best outcomes. Additionally, the deltoid ligament may also have been repaired if there was no fracture to the medial malleolus, the bump on the inner part of your ankle that signifies the endpoint of the tibia. After surgery, Gomes will require extensive physio to maintain ankle range of motion and strength, rebuild his fitness foundation, and gradually get back to higher intensity activities. The slow, methodical, grueling process. One of the primary challenges for Gomes, and this is part and parcel with any major injury that requires an extended rehab, is mindset. It's a long, winding journey to get back to full fitness, and it can be a daunting task when you look up at the peak from the bottom. In my experience with these severe injuries, the mental battle of extended rehab can be a dark and lonely place where you're spending hours and days and months with the same person, away from your teammates, club, and what you love to do. Accordingly, it's key for Gomes to keep a positive growth mindset that views the injury as a challenge rather than as a defeat. This mindset can positively influence every aspect of recovery, and there's more and more research substantiating this. A key element of maintaining that mentality is support and encouragement from the club and fans. Gomes has seen that in spades, and it's been a beautiful thing to witness.
Hi everyone. As you already know, everything went well. I'm already at home with my family, and I would like to thank you all for the support, the message, and the positive energy.
It's quite difficult to put a definite timeline on Gomes' return timeline and if or when he'll be the same player, because the research is frankly all over the place. Ankle fracture dislocation injuries involve multiple different variables, so it's difficult to group them together and create a sample size that actually leads to a meaningful conclusion and consensus. That being said, you're looking for some answers, so we did our best to synthesize all the information available. It'll take Gomes a minimum of 4 to 6 months to get back on the pitch, and even then, many athletes don't feel like their ankle is quote 100% even at 1 year post-surgery. It can take numerous years to regain that feeling and confidence. That sentiment is further reinforced by research which shows kinesiophobia, fear of movement or re-injury, as one of the last things to dissipate after major injuries, especially traumatic ones like Gomes suffered. An example of that extended process is Boston Celtics wing Gordon Hayward. He suffered a fracture dislocation on October 17, 2017, and is just now, over 2 years later, starting to look comfortable on the court. In Gomes' case, football is one of the few sports that places even more stress and demands on the ankle than basketball, so it wouldn't surprise me if his process takes even longer. The stark reality is that Gomes may never get back to his previous level. There's no evidence whatsoever to support a quote full recovery, and, in fact, we've only found evidence supporting that he'll likely never make a full recovery. That certainly doesn't mean he can't get back to being an effective player on the pitch, but he will likely always have to manage persistent stiffness and discomfort in the ankle, be very disciplined in his strength and conditioning program, and continue to mitigate any risk for compensation and subsequent compensatory injury. One significant positive for Gomes, you know I like to end on something positive, is that his injury primarily involved twisting or quote rotational load, which tends to have far less damage to the ankle cartilage compared to compressive or quote axial load injuries. This preservation of the cartilage is key for function and longevity because cartilage is critical for distributing stress, absorbing shock, and reducing friction in the joint. Additionally, Gomes has access to elite medical care, which always bodes well for overall recovery, ongoing maintenance, and return to high-level performance. That's a wrap for this video. Thanks for watching. My goal is to provide you with in-depth, evidence-based, narrative-free analysis, and you can always find me on IG and Twitter at 3CB Performance. Make sure to sub to the channel for the latest updates. 3CB out.